So what ways of administration are possible in Belgium? We have gels, injections. Do we also have a compounded cream for scrotal application? So just give your thoughts on all that.
In Belgium, we have much less testosterone now. For example, before you could compound a testosterone gel or a liposomal cream of 10%, which is efficient. And we only have, by law, forbidden, we may not give more than 2.5%, which is insufficient. So we do have transdermal gels that are officially, I may not name a publicity name, but basically 2% that works. That is not bad, but not sufficient to get the levels where you should at the average of young men on the average. So then we have injectables, but the injectables we have in Belgium, one is called Cystanon, doesn't work as well as the testosterone enantate. That is worldwide the best, actually, or testosterone cypionate could also be given. So we get the testosterone from Germany or from France, where they do have testosterone enantate, 250 milligrams injections on the average, given every 2 weeks. Some need it shorter because they do more sports or they're so physically active. And then you have a lot of gels of 1% or something, but it doesn't make much difference. So you will help a person who's very deficient, but you won't make that person optimally healthy or healthy. We don't have much other things here in Belgium. We do have also an injection you give once every 2 months and not every 3 months, like it's written. It's called Libido. It's testosterone indicanuate 1,000 milligrams, and that's an option for men who don't want to have too much problems. Internationally, you have implants that we don't really have in Belgium. Implants of testosterone that seem to work well. Or we also have an oral form that is called Andriol, but basically the Andriol doesn't work as well as the testosterone transdermal cream or injections. So that's what we have here in Belgium, but that's enough to help patients to feel better.
So your first choice is testosterone enantate injections.
My first choice is a liposomal cream. We get a 10% transdermal. And once the person is 60 years or older, he goes generally to injections, and then it works better. But for the younger, they prefer taking the transdermal gel. They also travel so much. And basically it works very well, but it has to be a 10%, which is in Belgium, in pharmacy, forbidden to sell for reasons that are inexplicable. I won a first trial against the government to overthrow that, and I won it. And then they did a second, and unsurprisingly, the judges accepted the uninformed or badly informed demand of the Federal Agency of Medications.
Yeah, too bad.
Consider becoming a channel member for exclusive features, like loyalty badges, early access to new videos, funny stuff like rough cuts and bloopers, members-only photos and status updates on the community tab, and members-only livestream chat. On desktop, use the join button next to the subscribe. On mobile, use the join link in the description.